questions. Number one, what is resilience? That's number one. Number two, in what context is this word used? When do we use this resilience? And do you see some people around you who you would consider especially resilient? If so, what makes them so? What makes people around you more resilient than others? That's 4 questions. We will try to answer them as we go through this presentation. It's a big topic, but I try to summarize it into a couple of slides that will go around. Then in the middle of presentation, we break out the session and try to discuss in groups on what can be the role of professionals in building the resilience. When we say professionals, understand I mean doctors, I mean nurses, midwives, allied health professionals, and pharmacy professionals. Those are 4 categories of health professionals we are having here in Rwanda. And when we discuss, all of us, you should be included into the discussion. Actually, when you go around, you have that resilience have many definitions. And I try to summarize those definitions like this. When we say resilience, we want to mean a positive adaptation. It's a positive adaptation when there is a risk or when there is an adversity. This is one definition. How do we positively adapt in a context where there is a risk? In a context of COVID-19, in a war, in other disruptions, how do we adapt positively? When we say resilience, we want to allow you to recognize when to slow down or say no, gives you the determination to keep going with something important when you attempt to give up. Resilience does not constitute an individual trait or characteristic. It just involves a process. So take home message. When we say resilience, it's a process. It's not a trait. It is not a characteristic. It's a process. And throughout this presentation, I will try to see how you can build resilience, how you can become more resilient amid of this COVID-19 pandemic. When we say resilience, we go beyond being well-being. Resilience is more than well-being. It also insulates us in the face of difficulties. In the middle of a pandemic, we became insulated. We became more strong to address the pandemic. When you say resilience, it will help us to recover and grow as a result of adversity. Fellow health professionals, when we say we want you to become more resilient, we want you to become more strong as this pandemic is going out. When we phase out the pandemic, we expect more strong to face it. Resilience, when you develop resilience, you develop the strength. That means the well-being will be improved as the resilience is increased. This is a good definition of resilience. It's more than well-being, and when you have resilience, you can face the difficulties, and you can also recover and grow as a result of these difficulties, such as the COVID-19 pandemic we are facing today. So, in a case of pandemic, such as COVID-19, there are some attitude, there are some observed which are negative, and there are others that you can observe as positive. When we heard that there was a pandemic in 2019, December, in China, we said, oh, we are going to have this pandemic in Africa. Are we ready? We had fear. We had stress. And we also, in case of pandemic, there may be death and losses. And people will be confused. People will be angry. They will have low mood. They will change in behavior, in attention and concentration. And these are negative attitude, such as fear. And when we have fear, we are going to impact on a relationship. We will decrease our flexibility of thinking and coping, sense of urgency, and therefore the resilience will decrease. People will close door to running. You have seen schools are closed. But in pandemics also, there are other people who are going to have compassion, who will be community mindedness, who will be concerned, such as health professionals. And these are opportunity. When there is a challenge, I like this, a challenge, an opportunity. A challenge like COVID-19 is associated with an opportunity to learn how viruses work. For example, how mutation appear. When as health these are opportunities that we need to have opportunity for learning new things, creating relationship in another manner. And also we will have a flexible thinking and more urgency. So when we develop compassion, community mindedness, and we are concerned, see in all of us as health professional, we need to start new relationship, partnership, vaccines produced here, drugs, why not? These are an opportunity to think again and try to understand what a resilient health system. In an organization such as a hospital you are working in, such as a pharmacy you are practicing in, such as maybe an office, we need resilience. And there are some considerations that are associated with resilience, such as the demand, like a workload. When you have a heavy workload, how do you adapt to that heavy workload? The work pattern and the working environment also, they affect the way we are practicing, and you need to put a balance between your work and your life when you want to build resilience. And in the organization, there are control. And then people, their managers, they manage you, they control. When they are controlling you, how do you become resilient to facing this? And also in an organization, when we promote resilience, we need to support people. Supporting people, like encouraging them, sponsoring maybe for postgraduate studies, giving when they support each other. When you work with your manager, I don't like your manager. I don't like bosses. People, they say boss the manager as a boss, when you see the leader, the team leader as a boss, how do you manage that relationship so that you can support each other and develop a resilient environment? Resilience in an organization also include relationship you are having at your work. How do you work together with others, supporting positive thinking, working to avoid conflict, dealing with unacceptable behavior? In a multidisciplinary team, we are working in a hospital with multidisciplinary team, with people with different
Hello? I think we lost Mr. Darius
to
for.
acceptable behavior. When you learn that, you will become more resilient. And in an organization, you will be resilient once you know your rule. There are people in an organization who don't even understand their terms of reference in their work. So you need to understand what is your rule in an organization, what are the boundaries, what are the scope of practice. When you are an anesthesiologist, what is your scope? You can do this, but you can't do that. This, when you learn your rule, when you learn your scope in the practice, you will become more resilient. And you know, there is a saying that the change is the only constant in this world. So everything is changing. There have been this pandemic of COVID-19. Maybe tomorrow we are going to have another one. But in an organization, how is a change managed? When there is a new director general, how do you cope with the new one? This, how do have will make people become more resilient, and we want to see people, health professionals as you are, more resilient in your practice. Mindset. When I say resilient mindset, you need to have a resilient mind, creating a sense of humor, the sense of relief in dark times. There are dark times like pandemic, COVID-19, but how do you create a sense of humor? And you need to be optimistic. You need to develop an optimistic mind. What do we mean by an optimistic mind? It's distorting the reality to not thinking about the danger that can spread the disaster, the pandemic in some situation, but you create a sense of possibility with a demoralized team can be a powerful tool in some circumstance. You are the head of maybe internal medicine department in your hospital. Building resilience will involve having your team in a demoralized spirit and try to show that though we are having this pandemic, we can make the care possible to our patient. We should wear the PPEs and try to continue providing the care the people want. This is what we call creating an optimistic mind, showing that there are possibility. Though the time is difficult, the situation is difficult, but we need to show our team that things are possible. And amid of a difficult situation, amid of a pandemic, we need to search for a means constructing a better future, we need to try to build a bridge from the hardship to a better future. And of course, as professionals, we need to develop values. When I say values, we need to, evidence has shown that when we have strong values, when you align to code of our ethics, to the code of ethics of our profession, we will become more resilient. I give an example that religious institutions, churches, they have been there. Catholic Church, for example, because of their values in their religion, they have been there for 2,000 years. Their doctrine has been there for 2,000 years because of values. And values will help to build the resilience. In the middle of difficult situation, amid of a pandemic such as COVID-19, we people, we need to be inventive. We need to be innovative. When I say inventive, what do we mean? It's just to take what is at our hand and actually do something with it, rather than looking for what they think they need. In this pandemic, we want the population to have to wear masks, and we need to create a sense. What can we do that people can wear masks? You have seen there have been made in Rwanda masks. Pharmaceutical plant started to produce those masks. That's we need to be inventive and try to bring something new that was not there. So every challenge is associated with an opportunity. When you become inventive, innovative, you will become more resilient. And as a take-home message, when you want to be resilient, let's take 5R. The 5R is just to reach out to others for help, relationship. Whichever they say that means that everyone can play a role. That's building a relationship, working with others. Recognize that people have what you need. If you are an anesthesiologist, you need a doctor, you need a nurse, you need a midwife, and then you can work together, create a relationship with others. The second is to create a sense of recognition. You need to recognize that there are signs of distress. There are signs that can show that your team, your people are becoming stressed. So you need to create a sense of recognition. And the third R is the reflection. You need to be aware that people, the self-awareness and choice. The people will say, no, for me, I can't walk into the intensive care. So you need to recognize that people may have choice, their choice. So you need to recognize that. That's what I call reflection. Another one is regulation. So the regulation, what is in place in the regulation, and the last, which is not the risk, is the resource. Becoming resilient to face the pandemic require resources, and these resources should be put into place to cover what is needed to face the pandemic. And this first part ends with the general definition, building resilience. But what do we mean when we say a health system is resilient? What do we mean? When I say the health system, you see it into this pillar. The one health system, the leadership, policy, and governance, the human resource capacity, the health information and communication, the the universal health coverage, how we reach to people in hospital, health center, health post. And when do we say that our health system is resilient? We say that the system is resilient if it has the capacity to prepare for and effectively respond to crisis. So in our Rwandan health system, if we are ready to prepare for a pandemic and effectively respond, we'll say that the system is resilient. And if it can maintain the core function when there is a crisis, then we will say the health system is resilient. And also when the system is informed by reasons during the crisis and reorganize if conditions require it. This is when we say the health system is resilient. Resilience has 5 key elements. The 5 key elements is awareness, adaptability, diversity, regulation, and integration. The awareness means that the system is able to detect the health threat before they strike. The system is able to detect that there is a new pandemic. That's awareness. The adaptability back from shock stronger than before. Our system need to be stronger than before the COVID-19 pandemic. Diversity, it's the ability to deliver a range of services with people will be able to have health supplies without any financial hardship. And this ability to deliver, though we are in a pandemic, we are also able to continue deliver maybe the maternity services, the treatment of malaria, non-communicable diseases, and so on. If we are able to maintain those services, though we are in a pandemic, we say this is a key element of the health system resilience. And then the system is able to self-regulation. It's the ability to prevent health disruption from turning into diseases. When there is a pandemic, there is a health disruption, the system to be resilient should be able to prevent this disruption from the turning into the disease. And then the last one, which is not the least, is in the integration. It's the ability to rapidly deploy resources from beyond the health system. We have seen this one in COVID-19 management. I've seen that the local government, the national police, they have played a huge role. The academia, they played a huge role in facing this pandemic, starting from the university deploying their students to help the healthcare professional in managing the COVID-19, the police officer, the army, all of those people. If our system is able to deploy resources beyond the health system, then the system is resilient. So when we want to make a resilient health system before the crisis, before the pandemic such as COVID, there should be a plan for response and accountability. And also there should be development of strong and committed health workforce. This is before the crisis. And when the crisis is there should be a vigorous public health response and proactive healthcare delivery system. And as a dividend of resilience, in the time of crisis, resilience will be estimated according to the lives saved. and the livelihood protected. And the time of calm, there should be measured as a healthier people and a stronger nation. So before we go into breakout session, let me talk about the resilience beyond this pandemic. The COVID has shown that our system are fragile, and there is a need to boost the resilience of this system to respond to diseases outbreak. And priority should be given to community-led health initiative and health workers. And also there should be ensuring that reliable medical and diagnostic supplies are available and fostering evidence-based practice and raising additional resources. The four elements that are necessary to build health system resilient, a resilient health system beyond this pandemic. Maybe to have a system that can also face any pandemic, we need to have what I call community engagement. Community engagement means that we need community health workers to serve as a bridge between the community and health system. And these community health workers, they need to be trained. They need to be given a special training on how to deal with pandemic, how to face the pandemic, and then they can form a bridge between the community and our health system. And there is a need for medical and diagnostic supply, such as PPEs, personal protective equipment, the intensive care, the ventilator, the production of medicine, the production of vaccine, blood products, diagnostic and medical devices. The government, the health system need to think about how can the system have its own production plants for essential products, PPEs, medicine, and other diagnostic and medical devices. And of course, the system should emphasize on governance of data because data will inform the policy. We need to have quality data. And when we say quality data, they need to be generated, shared on a timely, then this data can categorize the response. When we are generating data, they can guide the policy and categorize the response. And of course, we need to think about the infrastructure. When we are talking about the Vision 2050, the Sustainable Development Goals, and the National Strategy for Transformation, we always need to invest into the infrastructure
Hello?
and the moderator will help me to break the session into groups, and we should be responding what can we do as health professionals to become more resilient amid of this COVID-19 pandemic. What can we do as health professionals to become more resilient? Over to you, moderator, to break out the session. Then we'll take 10 to 15 minutes for discussion, and every group will choose a secretary and a chair, and the chair will share what they found that they can do as health professional to be more resilient. As we have been discussing the resilience and the resilience of a healthcare system. And over to you, moderator, for this session. We'll come back at 3:10.
Thank you so much. Yeah, thank you so much, Mr. Darius. We would like to, before you go out for the breakout rooms, the network was not in good conditions. You are on and off, so we would like you to give us like a brief summary in like 10 minutes of what you explained from the beginning, because the network was on and off, and then we can go for the breakout rooms. Thank you so much.
Hi, Darius. Can you share the screen of questions, because I'm going to make 3 rooms?
Hello, Mr. Darius. Hello. I think we will need maybe a communication from Mr. Darius to direct us on how the session will be. We did not get the questions very well. Maybe we can discuss on what we can do here in the main session as regards to the breakout rooms. We can discuss from here. Mr. Darius, what reality version? Anima, maybe people can put up their hands and mute, and then we can discuss from here. Thank you.
So, moderator, so is there any difficult to join the breakout sessions?
I think they had not gotten the question, and since time is going, we can discuss it from here. Maybe you can tell us the question and we can get hands up and then we discuss about it. That's what
Okay. Okay. Let me bring back the presentation, then we can discuss.
Hello?
This question is for all groups.
Yeah, but Agnes,
Yes.
yeah, we are proposing by the moderator that we stay in the main group in this one, and then the discussion is going to be carried out here.
Okay.
Yes.
All right.
Yeah. So the question is, what can we do to help health professional resilience amid of this COVID-19? If you have a suggestion, please put up your hand. Then you can unmute and give us your suggestion. Thank you so much. There's so much silence in the group. Ikibazo cyangwa suggestion on this topic on what health professionals can do to stay resilient amid this pandemic. Please let's participate and contribute, and we learn from each other. Okay.
Yeah, participants, we want to hear from you. Maybe you can raise your hand, then the host will let you unmute, and then you can contribute. We have been talking about the resilience in general, the resilience of health system, and then we want to hear from you what can be your rule. Want to hear from you.
Okay.
Moderator, there is a raised hand, please.
Yes. You're feeling your Seraphine. You can unmute and give us your suggestion. Thank you so much.
Hello.
Hello.
Okay, thank you so much. My name is Nyokwiringe Serafe. I'm a physiotherapist. I want to contribute to this question. What can we do to have health professionals resilience amid of this pandemic? For me, the things that should be done, first of all, is about sharing information. Because if you observe or hear what professionals said, you will see that most of the people, they have different view or views on this pandemic. So the first thing is to have the same information about the pandemic so that we can help our community amid this COVID. The second, as our presenter has shown, we need a strong infrastructure. But when we say infrastructure, for me, I even include human capacity building. We have to build the capacity of our health professionals, because as I have seen this pandemic, when the COVID-19 comes, you would see that everyone were surprised. We didn't have any idea about this pandemic. So I think government also should invest more in the capacity building so that we can have a strong and resilient health system. Thank you so much.
Thank you so much, Serafin. We also have a comment from Miranda Kunyani that says, since COVID-19 has been a challenge to everyone, we firstly and highly need to be informed about the pandemic so that we can be able to help the community. Yes, thank you so much for the comment. Anyone else that has a comment or suggestion? There is a comment from Ernestine. As HCP, we want to have a common understanding. Is this a question? Yeah. Anyone else that has a comment or suggestion, please let us know so that you can contribute to the session by participating. Thank you so much. I'll be reading comments from the comment section. There is a comment that health professionals need to be protected for their safety so they may continue to contribute for the benefits of the public. Thank you so much, Mr. Hakizimini says, for me, I think that we need to do first. What we need to do first is the ownership and commitment to be resilient. Thank you so much for the participation.
I think the time we allocated for this discussion is now over, and we can continue with the presentation. And we encourage people to continue giving us their point of view into the chat box. Then at the end of the session, in question and answer session, we also read those comments if you are all moderator.
Yes, it's
great. So we can continue. So as people mentioned that as health professional to build the resilience, we need the information. We need to be informed. This is a point that was raised, and I will start with it when in this presentation. So for health professional to be more resilient, we need communication. The second one, we need psychosocial support and treatment. And of course, the monitoring of health status should be done. These are 3 points. that I will develop around the building of resilience. So the communication, we understand that there should be a responsible for grouping kind of information available for the pandemic, the COVID-19 or any other pandemic that may occur in the future. People need information. When you group the information, you need to share them. And there should be communicated the realistic scenario or actual scenario should be discussed within a healthcare team that provide direct patient care. As you saw amid of this pandemic, the COVID-19, as the information flows, the guideline and instructions and the regulation change. So as evidence are being generated, people will need to get this information. What I mean by information is that to encourage you people in Rwanda, we as health professionals, we need to also generate information. Not only grouping from internet, from researches, we need also to generate information. We need to conduct researches. When we research and we will generate evidence. And of course, in our practice, we need to create a blame-free environment. A blame-free environment, when you have a blame-free environment, we will promote the ability to report incident, ethical or emergency issue, challenges, and advice for the management. Wherever we are practicing, we need to do not play a blame game, blaming, oh, this is an error of this one. This is because of the anesthesiologist, because of a nurse, because of a doctor. We need to create a blame-free environment. As health professional, we need to create a platform where we can share information, a website. We thank to this great organization, Health-Edu, which has provided this platform to share information on resilience. This one of platform for sharing information. Website, we need the website. And of course, there should be a short communication line between professionals for us to get information. This is number one when we think about developing resilience as a professional. We need communication. That's number one. Number two is great. The number two, as I said, there is a need for psychosocial support. So we need to create an enabling condition in an outbreak for optimal professional psychosocial support for professionals, both in regular care and in acute situation. We need to have sufficient resource and capacity for support. We can't expect the optimum performance of health professionals if they don't have support. And we need to create a simple organizational structure for the support team. And of course, we need to make available that service of psychosocial support available 24/7. And there is a need for efficient referral system for those people with physical or psychosocial problem. I saw in the comments people mentioning that we professionals, we need to be protected. So people will have panic because they don't have mask, for example, to wear while they are providing the care in the middle of this pandemic. So we need that psychosocial support. And the last, which is not the least, is monitoring the health system, the health status. So we need to be aware that in a pandemic, some people will develop mental health problem. People will become physically ill. And amid of this one, we need to monitor our professional to see whether there is a problem or any other outbreak is there. And beside this, frequent and casual monitoring of the physical and mental status should be done. And there should be check-in and check-out when people are coming to provide care amid of the pandemic. Next, please. And when you provide we do the monitoring, I want to emphasize on this key element. We need to clarify task and responsibility. For people in any pandemic, people will panic, and we need to have a specific task for everyone. And that's why there should be a very good provider and patient relation. That means that people will not be overloaded with the workload. And also the working pattern should be established. And ideally, we should have a shift of maximum 12 hours. But we see people will be working 24 hours. And then people will panic because there is a pandemic. Someone raised that capacity, human resource. The human resource capacity is limited. And people will have to work extra hours when there is a pandemic. And this is something we need to monitor and see how people are working. And then the team composition, when we deploy people, we need to see who are deployed, what are their capacity, what are their skills. In any team, we need to address the pandemic. And then when we put up a team, we need also to build it by creating a sense of togetherness and positivity. People need to work together to address the pandemic. And then when we are working together with a wide range of skills, we will be resilient. Next, please. Next, please. And while we monitor also the status of our health, people are autonomous. Some people will refuse to work in the premise where they are COVID-19 patient, and they should not be judged. So there are people who will be courageous and then go to face the pandemic, and there are others who will refuse to work amid of the pandemic, and they should not be judged. This is something difficult, but we need to respect their choice because they are autonomous. And facility. I like someone who raised that we need facility. So people, when they are facing the pandemic, they should also have a specific room where they can rest, they can retreat, they can share information or even sleep. This is a facility. And of course, the core element that should be monitored amid of pandemic to avoid people panic, to have our people resilient, we need to monitor the availability of materials and supplies. Though training is important, having skills is important, also people should have material, PPEs. Someone raised that issue that some professionals, they don't have adequate personal protective equipment. This is something that should be taken into consideration. And then monitoring also the compensation. People should be compensated that when you are working extra hours, you are working in a pandemic, we should think about the compensation of health professional. And if possible, food and drink should be availed for our presentation. Resilience. When we say resilience, it's the capacity to rebound back from any threat, such as a pandemic, such as a natural disaster, such as a war. When, as a professional, we need to develop that capacity. Developing the capacity requires that people communicate, people get access to information, and I encourage each and everyone to not only search for information, but also generate the information through research. And of course, we need to support each other for the psychosocial part. And of course, we do the routine monitoring. Otherwise, I thank you so much for your participation into this presentation, and I welcome the moderator to facilitate the next session for question and answers. People may raise their question directly, they can unmute and raise their question, but also they can go into the chat box and type. Thank you. Over to you, moderator.
Thank you so much, Mr. Darius. This has been a really great session and we have learned a lot. For anyone that has questions, this is the question and answer sessions that we have gone into. Please raise up your hand and then we can give you access to unmuting and asking questions. I will be reading a number of questions in the chat box. One says, how can you explain that the systems are resilient now while the numbers of COVID-19 cases have gone very high and we are forced to be locked down? I think the question is how can you explain the relationship between the resilience and the numbers going high and being in lockdown? Thank you. Hello, Mr. Darius?
Yes, please. I can hear you.
Yes, I was reading a question here from a participant.
Yes,
Can I repeat it?
please.
Yes, it says, how can you explain that the systems are resilient and the numbers of COVID-19 cases have gone high and we are supposed to be in lockdown?
Thank you. Thank you for this great question. And of course, you raised that question cases are increasing. And also, as a response to the system, they have put up a lockdown. As I said, for a system to be resilient, it needs to generate the information that inform the policy. The policy to take a decision, a very hard decision as lockdown, it's because there was information. We are lucky enough because we have a system that can generate information. You have been seeing the current mass testing of people to get the information that can generate evidence to inform the policy. For me, I think the issue is not with lockdown. The issue is the new variant. As we learn day by day that the virus is mutating, there is a need, of course, to stop. They say there's a good saying which says that the virus itself is not moving. It's us as people who are making it move. And when we move, we spread it. When we restrict movement, we stop the virus to spread. One of us says that this virus, if you can see into comment, there's someone who says that the virus is serious. And if the virus is serious, we need to take serious measures. And serious measures include, of course, lockdown. Let's expect the best from our health system as we are going through the lockdown, and we hope the best that the cases will decrease. That's what I can say. Thank you.
Thank you so much. Okay, there is another question here that says, in a situation where the practitioner has no control over the workload, how does the practitioner cope with the situation to be resilient in these times?
Of course, the workload is an issue. As I mentioned, that resources in our developing world. One thing is to train more people. As an individual, you may not be able to increase the number, but as a system, we need to advocate to increase the number of trained health professionals. That's one. And if you can see, the seasonal tough policy are being put into practice, such as the task shifting. That's one thing. You have observed the task shifting for HIV treatment, where they shifted the task of treating HIV from doctors to nurses. You have seen that there's a task shifting for treating malaria from health professional to community health workers. These are decisions which are being taught, but also we need to document, as I said, we need to generate data. But as I said, the health system itself to be resilient, it has to be a community, the capacity of our community health system, so that many health problems can be solved. The leadership of health system that thought about the health post, and we expect that in every cell there will be a health post that can deal with those minor health problems, so that we at the professional level, working in a district hospital, we can deal with maybe complicated cases. So we need an effective referral system, starting from the community health workers to national referral. So, of course, you may not have a direct control on the overall, on the workload, but also you can contribute to raising the issue, to generate the evidence that the workload is heavy. Let me challenge you. Have you ever thought about generating the information, if you are a nurse, for example, of the average number that a nurse is dealing with a day in your health setting? I don't think that you are going to say yes, but we need evidence. Can you start as an individual by generating evidence, by highlighting to the leadership that the workload is heavy? That will be part of an advocacy. That's what you can do as an individual. Thank you.
Thank you so much. I think that has been a really good explanation and good answer. We have a question here that is a bit long, and I'm going to read it. It says, my question is, do we every day see the number of new cases for COVID-19 and even the deaths? In the Rwandan community, we see all the categories are affected by COVID-19 and some died, but if I remember well, we didn't meet new cases at the age from newborns up to 5 or 6 years old. And we all know that as the elder people are at a risk for COVID-19, also the mentioned category of babies and children are also at high risk. So what should you comment on that, where we didn't see any deaths for those babies and little children for COVID-19? What really made them safe while others are affected in big number? Thank you. This is from Eric Harinan. Hello, Mr. Darius.
Moderator, can you repeat the question? I'm asking, is he asking that why are children safe?
Yes, why are children safe and most elderly people are affected? So like what made them safe while others are affected in big numbers?
Okay, thank you, moderator. This is this is an interesting question. Maybe I will not address it correctly, as the topic of today was not about going into details of COVID-19, and I'll share my personal thought. I may not address it correctly, but as the evidence is being generated, we have seen that the COVID affect, there is a risk factor of getting a serious illness when you are old. There is a risk to become seriously ill when you have comorbidity of NCDs. And to address issue with children, you know, the children are building their immunity. Their immune system is being burst. And I think when the virus entered the human body of a child, the child will start to build the immunity in any routine way of doing so. But this is something you can research on, and was not part of our scope of the presentation, but we can research on that and address why, maybe plan for another session on the vulnerabilities. And I think as far as the information is available, people with the senior citizen, the seniors with an elderly, the geriatric population is more prone to serious illness. And of course, because their immune system is not strong, people with comorbidity of NCDs, HIV, and those are more prone. But we have seen that children also die. I like someone who said this COVID pandemic is serious. We have seen children of four months, if I remember very well, they also die from the COVID. So none of us is protected. Let's remove that bias. We need to take measures to prevent the spread, because children also died from this pandemic. Of course, the rate is not the same, but also they died. That's to mean also the pandemic is serious to everyone. We need to take appropriate measures. Thank you.
Okay. As we are getting to the end of our session, I'll read the last two questions that has. My question is to know technically, countries with limited resources, for example, Rwanda, how can they build health supply chain resilient and sustainable during this COVID-19 and beyond?
Thank you.
Yeah, thank you.
This is a great question from Mr. Jean Damascene. And of course, I said the pandemic itself is a challenge, but also it's an opportunity to go and think, to reflecting in our context, that COVID has crossed borders. COVID has created the stockouts of essential commodities, protective equipment, has created stockouts of necessary items. And I think this is a great opportunity to be innovative, as I mentioned. Innovative and try to see what can we do. You know, if you discuss with leadership of big pharmaceutical company, they say, for example, gloves from this plant has been booked for 6 months, and you are there, you want to cargo for mask. They say, no, we will not serve you because these have been booked. You heard the history that some masks were deviated in Nairobi to a European country. This is because this need to teach us to see how can we innovative and bring up our pharmaceutical plants. This is one. For our system to be resilient, it is one point is to reflect how can we at least produce essential commodities in our country, if not possible in our country, in our region. That's number one. We need to reflect like that. The second one is to establish partnership. Partnership as a smaller country with maybe 11 million population, our needs are small compared to big nations such as China and India, and we create a small market. So we need to establish partnership in the region and try to put up what I can call the pool procurement, procuring together. If you are working in a wholesale pharma, for example, Mr. Jean Damascene, can you think about partnering with another wholesale pharma when you are to procure a paracetamol? Then you will increase your buying capacity and you will be welcomed in a pharmaceutical plants in China. They manufacture for your group. This is a mind we need to set up. The first is to try to see how a country can produce at least essential commodity. If not possible, a region. If not possible, Africa. We need to think like that. And the second one, which is an option also, is to work with others and try to buy together. We compile our request and we become a strong buyer that we can access to these commodities. Otherwise, Mr. Jean Damascene, I'm not an expert in supply chain. That was my thoughts on this. Thank you so much.
Okay. Thank you so much. I think this has been a great session. There are so many questions coming in. There's one still from Mr. Jean Damascene. With 900 and above cases a day while in lockdown, how do you see the curve?
The question is?
The question is that with 900 and above cases a day while in lockdown, how do you see the curve? It's the last question in the chat.
And I think the curve, I think data are being generated and they are conducting researches. You know, yesterday there was mass testing, last week also there was mass testing. They are generating data. And I think it will be very early to say that the curve is flat, the curve is this and this. It's better we wait for the data to be generated. Of course, 900 cases a day, it's huge. It's see that the pandemic is now in the community. That's one information from that 900. And I think 900 is very little, and as the mass testing continues, we need to to wait for data and see. But what I see is that the pandemic is in the community. It's now an individual responsibility to take preventive measure, and it is a professional obligation. It's an obligation as professionals to promote that people can adhere to prevention measures that have been set out by the country. And this is also a call that people need to be vaccinated. And I think soon we'll see maybe the vaccination rate increasing. I thank you so much. There's another contribution from Benedict on that question. He say, I think it's a need a multi-phased approach. First, policy, government must make conscious efforts toward pharmaceutical industry. This is a contribution to random strength. Yes, they need to set up a pharmaceutical industry, give them tax incentive to produce what the country needs, and give a conducive environment for investors to support the industry. Yeah, this is a great contribution from Mr. Benedict. Thank you, moderator.
Thank you so much. I would also like to thank Benedict and other participants for their contribution. This has really been a good session with the interaction, the session. We'd like to thank our instructor today, Mr. Darius. Thank you so much for the great session. It has really been insightful and educative. Thank you so much. And to give a,
thank you so much. I've seen that your platform has shared how to get the presentation material on the website. This is also something we need to highlight as we conclude the session. And also, I want to thank everyone for securing these 2 hours to come and share with us the thoughts on how to be resilient. I expect each and everyone to take steps in developing personal resilience. As we develop personal resilience, we develop resilient health professionals, and then we will also contribute to the development of resilient health system in Rwanda. I thank you so much and wish you a great evening and also a great weekend. Thank you.
All right, thank you so much. Thank you so much, Mr. Darius. Thank you again for the great session, and we hope to have you back in the future. As a few remarks on the certificates, because this session has been free, to be able to access the website and certificate, as there will be a kind of an exercise to check if everyone has participated very well from the beginning to end. You'll have to pay an amount of $1 USD, 1,000 Rwandan francs to be able to access it. So the link is shared in the chat box below for Health-Edu. You please get the link and go over to our website, check it out, and you'll be able to get all the reading materials related to what we have learned, and also a certificate that shows that you have had this. Thank you so much. I think we have come at the end of our session. I would like to thank all the participants for attending, for participating. We hope to see you in the future sessions and webinars that we'll be preparing. Thank you so much, everyone. See you next time. Bye.